Welcome to our Hair Detective series, where we unravel real-life cases to solve complex skin and hair mysteries. Today, we're solving the mystery of a case of rapid onset hair loss or hair thinning that went on a wild goose chase. So this middle-aged patient started with no prior history of hair loss. Unlike many of his peers at the same age group, he had no visible signs of male pattern hair loss to begin with. However, a few months ago, he noticed an increased amount of loose strand hair fall while combing. He thought it might be due to stress or some scalp oil buildup and hence first visited a hair care trichology center. He was diagnosed to have increased scalp buildup and was sold a package of treatments that were designed to help cleanse his scalp to promote better scalp health. However, instead of noticing increased progressive reduction in hair loss, he subsequently saw that even loose strand hairs were falling with light brushing or light touching, and this caused him to be alarmed when the hair loss increased to more than 100 to 200 strands per day. He then sought help from a hair restoration clinic. Extensive blood tests were done, but they all yielded no positive results or no telltale signs of any underlying condition. He was, however, given a diagnosis of telogen effluvium. Telogen effluvium is commonly a basket diagnosis that is given to patients who present with increased shedding or increased long strand hair fall. This can happen after a myriad of conditions, for example, increased weight loss, such as 5 to 10 kilograms of weight loss in a short span of time, increased severe stress, relocation stress, illness, just to name a few. Nonetheless, he was prescribed topical minoxidil 5%, some hair growth supplements, as well as some special hair loss shampoos. Weeks passed and there was still no improvement to his condition, but in fact the hair loss continued to get more aggressive with rapid shedding. And this is where it is critical, because dermatologists are medical specialists trained to handle complex disorders of the skin, scalp and hair. After a detailed history and close physical examination, including utilizing specialized tools such as this, which is a trichoscope or what we call a dermatoscope, which allows us to zoom in specifically to look at key features, we were then able to arrive at a finalized diagnosis of Alopecia areata incognita. Alopecia areata doesn't always start as a circular patch of baldness known as coin-shaped hair loss. It can start also with diffuse thinning or even mimicking patterns of androgenetic alopecia, just like male pattern hair loss, making it hard to diagnose unless you know what you're specifically looking for in the clues on trichoscopy. This case is really interesting because its global picture could look more like androgenetic alopecia or what we know as male pattern hair loss. On the other hand, its time frame didn't match that of male pattern hair loss because male pattern hair loss or female pattern hair loss typically occurs or develops over many years before it progressively thins out. On the other hand, this case started with a rapid onset of shedding, which happened in a span of 2 months. This is also closer to a diagnosis of telogen effluvium, which is what the hair restoration clinic initially made the diagnosis or called off. However, the key difference is this. Telogen effluvium, if you look at close-up trichoscopy, doesn't yield features such as exclamation mark hairs or dystrophic hairs, which was widespread and evident in this case. Hence, it is important to note that specialized tools such as this or even a scalp biopsy might sometimes be required to confirm such a diagnosis. Alopecia areata in most cases starts off as a form of patchy hair loss or coin-shaped hair loss, and in this case, it was missed because globally he had a diffuse form of thinning and hence a rarer presentation of alopecia areata. After making the right diagnosis, it is then critical to evaluate your treatment options. And the management of alopecia areata will first range depending on the patient's age, other pre-existing medical conditions, especially the severity as well. So severity of hair loss can basically be classified based on the surface scalp area of involvement. If there's rapid onset, rapid thinning involving extensive areas of the scalp, then sometimes systemic therapy might be needed. However, we can first start with a tailored approach, consider options for milder cases such as topical corticosteroids and minoxidil. In this case, other options such as JAK inhibitors, which are newer class medications FDA cleared for the treatment of severe alopecia areata, can be considered. The treatment of alopecia areata is not going to happen overnight. The journey of each patient is unique, but typically involves many months of treatment up to even years, depending on the severity and the recalcitrant nature of their alopecia areata. This case is a great reminder that not all hair loss is the same or is equal. If you are struggling from sudden, unexplained or rapidly progressive hair loss, don't guess, but seek medical help from an established professional so that early treatment can be deployed. If you found this case helpful, interesting, or know someone struggling with unexplained hair loss, don't forget to share this video with them. So like, comment, and subscribe for more upcoming Skin and Hair Detective series.